Essential Pilates for January 2021. Starting in parallel standing, core muscles softly engaged. We'll flex the spine with cat and then take a nice deep breath in and extend the spine. Exhale, flex. Nice soft knees as you flex. Inhale to extend. Exhale, flex. Stretch and separate shoulder blades. Inhale, extend. And flex. Extend. Flex, extend. Add side stretch. Reaching over and back. Flex, extend with cat. Side stretch opposite way, reaching over. Flex, extend. Reaching over. So each time we take that side stretch, it's a gentle side stretch, and we change sides each time, creating the feeling of length into the side of the body. Gentle stretch of that arm overhead. Last 2 repetitions. And last one. Releasing the arm. You need some room sideways. We're going to drive it out with a standing lunge and back in. Driving out and back in. So we've got a little bit of lateral rotation here in the hip, meaning that our toes are turning out at an angle that feels comfortable to us. And as we step out and in, twice more in this direction. Hold the last one. Dynamic stretch, and we'll go over and back, same side all the time. So your hands going down towards your straight leg as the opposite arm reaches over the body. Be careful of this knee, try to keep it turned out into lateral rotation, and that should mean that you've still got a nice arch in the foot. Last one. Release to center. Now we need to step out and in the opposite way, so I'm going to come this way. Dynamic step out and in. Working 4 more in this direction. The further out you step, the harder it will be, so the warmer that you're going to get. And we'll stay out on this one. Dynamic side stretch. So the arm goes down towards the straight leg all the time. And we're taking that stretch over and back in the same direction. Going for 4 more stretches on this side. And then last one. Releasing it from there, taking it into a squat. Now have your heels quite wide and a little turn out with your toes here. Squat down, arms to W and up. This is going to give us external shoulder rotation, so it's important to keep your shoulders back as you're going into your squat. So you've got that connection between the shoulder blades being drawn together. Deeper you go, the harder you're going to work. So if you are feeling a wee bit cold, just sink a little deeper into that squat. Opening the chest. Last 2, we'll stay down in squat on the last one. For rotations, turning side and centre, same way. Side and centre, same way. Side and centre. 4 more this way. Try to stay down in the squat position with the knees bent. However, if you do find that you're reaching fatigue, come up to straight legs. Last one, change sides, rotate. Pelvis and legs are nice and still. isolating that rotation into the thoracic spine. 4 more this way. Last 2. And last one. Okay, so we're going to squat down and reach up next. Squat down and reach up. Squat down, reach up. Squat down, reach up. Again, the deeper into the squat you go, the harder you're going to work. So if you do want to work a little bit harder, just drop it down deeper into that squat. Now with this movement, we're going to add a rotation when our arms are at the top, turning side and centre. Squat down, push up, opposite side and centre. Squat down, push up, turn it side and centre. Squat down, push up, rotate it side and centre. Squat and press, twist side and centre. Keep going with this. Once more in each direction. Okay, so this time you're going to squat down, lift the knee, squat down, lift the knee. Changing sides each time. It will challenge your balance and your stability, as well as your coordination. Four more. Hopefully we're feeling nice and warm by now. 3, 2, and last one. Come to centre, roll the shoulders back. And release the arms. Now, if you have got access to a wall, that will be really, really handy for what we are going to do in this month's essential level Pilates. So the first thing that I want you to do is we're going to practice standing against the wall with good posture. And this means that we need to get the back of our skull, shoulder blades and sacrum against the wall. We'll stand with our heels away from the wall initially. Anchor through the sacrum, get the shoulder blades, and then you might need to do a chin retraction to get the head back, pressing the arms against the wall. If you find it difficult to get your head against the wall, you definitely don't want to be doing this with your chin poking up into the air in order for you to get your head against the wall, okay? So it may be that your head is sat a little bit too far forwards and your upper back is quite curved in terms of the kyphotic curve in the upper back. So these two things can prevent you from getting your head back against the wall. One of the most handy things that you can do if you want to reduce that curve and reduce the neck extension is to think about how you sleep. And if you sleep with a lot of pillows underneath your head, you may want to reduce the pillows that you sleep with. We spend about 8 hours, if we're lucky, asleep in bed. And if our head is high up on a couple of pillows, then we're spending 8 hours with our head in this position. Okay, right, so let's release that off the wall. Next thing we're going to do is we're going to stand against the wall, but this time we're going to try and get our heels, our calves, our sacrum, shoulder blades and head against the wall. So stand against the wall, get the heels there. You might need to do a little bit of a posterior pelvic tilt. My buttocks are quite big, so I've got to tilt to get my sacrum against the wall. So calves, heels, calves, sacrum, shoulder blades and head, just like before. Now I want you to notice what this feels like for your legs. Is it easy enough for you to get both of your legs back? Is one calf nowhere near the wall? Does it feel harder work for one leg than it does for the other leg to actually get the calves to touch the wall? Are both of the calves nowhere near the wall? So again, we're standing with really good posture here. And we're going to challenge. Think about squeezing your shoulder blades back and together. Reach your arms up and see if you can get the backs of your wrists and the backs of your hands onto the wall above your head. So this is full body stretch. We would normally do this lying down on our back on the mat, and trying to perform it against the wall is quite a tough one. During your day, if you can, have a few moments when you bring yourself to the wall during your day and have a full body stretch using the wall, using those contact points, heels, calves, sacrum, shoulder blades, head, and then those arms to stretch it out. And again, that will really, really help to correct your posture if you can spend some time like this against the wall. Only needs to be about 30 seconds or so, that's perfectly adequate. We'll release down and step away from the wall. Okay, third thing that we're going to do against the wall. This is a good exercise to strengthen our thighs and help to keep our knees strong. And this is a wall squat. Ideally, you're going to look for a right angle at your knee. So you want to sit yourself against the wall. So you've got roughly a right angle at the knee, and then again, sacrum, shoulder blades and head, and arms pressed flat against the wall. We'll start off just sitting against the wall. And as you stay here, you will start to feel the muscles in your thighs work incredibly hard to hold the position. I would suggest just starting with 10 seconds at a time. So if you do have knee issues, this is a really, really valuable exercise for you to practice. And you may find that you can't quite start at the right angle. It is okay to start a little bit higher up, so you can have a bit more of an angle at the knee if you find that works better for you. But build your way up until you can do 30 seconds of your wall squat. Fabulous. Okay. So number 4 is that we're going to work windows arms against the wall. And this is one that we would commonly do lying down on our back. So let's mimic being on our back. Heels, calves, sacrum, shoulder blades and head. And windows arms starts with our arms level with our shoulders. We pull the elbows back. So you're trying to get your upper arms onto the wall. Rotate. Back of your hands and forearms onto the wall. Reach to the overhead position and pull it forwards. So we bend the elbows, rotate the arms, extend the arms up and pull it through. Bend the elbows, rotate the arms, extend them up and pull them through. Bend the elbows, rotate, extend them up, pull it through, and one more time, bend, rotate, extend, and then just put all the way through and release it. Wonderful. Okay, push-ups against the wall. The further away from the wall that you stand, the harder it will be. We're going to lift our heels up and place our hands onto the wall and just lean towards the wall from the ankle. Elbows bend and straighten. And we can get a really, really nice push-up here to strengthen into the arms, but with quite a lot of reduced load compared to when we try to do push-ups on the mat, and we're either in 4-point kneeling or a 3/4 plank position. So the closer you are to the wall, the easier this will be on your arms and your shoulders. Aim to do 4 more. 3, 2, and last one. Pushing away from the wall to release. Excellent. Okay, let's go to the mat. Good news is you don't need to do any push-ups. We will be starting, however, in 4-point kneeling with cat stretch, flexing the spine as you breathe out, extending the spine as you breathe in. Flexing your spine as you breathe out, extending your spine as you breathe in. Flexing your spine as you breathe out, extending your spine as you breathe in. Flexing to breathe out, extending, breathe in. 2 more cycles. and last one. Now we will continue to flex and extend the spine. However, you're going to be work diagonally with the arm on one side, leg on the opposite side. So you'll also be going into shoulder and hip extension. Now I'm extended with my spine here, so I'm going to extend my shoulder and my hip on opposite sides of the body. And then as I flex, I'm bringing knee to nose. And then we extend. So we still get the flexion of the spine, knee to nose. We still get the extension of the spine. However, we are now working on our balance. Aim for 2 more this side. And last one. Releasing and changing over. Knee to nose as you flex. Extend and reach. Exhale, knee to nose flex. Inhale, extend and reach. Knee to nose flex. Extend and reach. Knee to nose flex. Extend and reach. Twice more. Knee to nose flex. Extend and reach. Final one. Knee to nose flex. Extend and reach. Come up to high kneeling. Hip flexor stretch. You're going to lunge in and out of it, so have a nice big open knee. And then sway, release. As you sway, the stretch that you feel in that back hip will increase. Twice more. Hold the last one. Take an extension towards the ceiling, reaching the palms, gazing at the hands and holding the stretch statically for 8, 7, 6, 5, 4, 3, 2 and 1. Releasing the arms, release the leg, switch it over. So dynamic, foot further forwards than the knee, sway in and out, sway in and out, sway in. Four more, 3 more, 2 more, hold the last one. So stay in that stretch position. It's all going to be down this back leg into the hip. Place the palms together, reach to the ceiling, gaze into the hands. We hold for 8, 7, 6, 5, 4, 3, 2 and 1. Releasing the arms, releasing the leg. Come to hands and knees. Rotating with threading the needle. We're going to leave one hand on the mat. We're raising the other arm, reaching towards the ceiling. So you've got thoracic rotation in this position. And then our supporting arm bends at the elbow. As we pass the arm underneath the body, you're reaching along the floor as far to that side as you can. We reach and thread, reach, thread, reach, thread, reach and thread. Twice more to this side, reach and thread. Last one, reach and thread. And then we change sides, come back to 4 points, stabilize, opposite arm reaches and threads, reaches, threads, reach, thread, reach and thread. Twice more, reach and thread. Last one, reach and thread, releasing. Sideline. Get something to bob underneath your head. working our rotations in our side lying position. So we're getting neutral in side lying, weight bearing through the shoulder, through the hip, legs are stacked on top of each other, top arm is extended. We'll take a breath in, engage the core, reach the arm and look at the hand. Breath out, rotate it backwards. Hold the end point of the rotation for 3 cycles of breath. We'll breathe in, breathe out, breathe in, exhale, return. Engage, reach and rotate, hold it, breathe in, breathe out, breathe in, and breath out to release. Engaging pelvic floor transverse, reach and rotate, holding breath in and out and in, exhale, release. Last time on this side, engage the core, reach the arm, rotate, breath in, breath out, breath in, and exhale to release. Side lying pelvic tilt with a thigh stretch. So we're bringing the heel towards the bottom and then tuck the tail between the legs, release, tuck and release, tuck and release. Now each time you tuck your tail between your legs, the stretch down the front of your thigh will increase. We'll go for 4 more. 3, 2, last one, and then release it. Use the pad or the cushion that you've had between your knees, pop it in between, sorry, you've had it underneath your head, you're going to put it in between your knees, pop it between your knees, lie on your back, open the chest, press the shoulders back and down, push the arms to the mat, the fingers to the floor so the wrists are really nice and flat. Try to avoid having your hands like this and flatten them down. So pelvic tilt, soft breath in, engage your core, breath out, tip it backwards, breath in, release it, neutral. Breath out, tip it backwards, breath into neutral. Stretching into the lower back, waking up the rectus abdominals. They're responsible for the degree of a lumbar flexion that we have. So if our abdominals are not very strong, then we tend to have a very, very deep lumbar curve because our back muscles, our erector spinae muscles are incredibly strong. So if there's imbalance between the 2 muscle groups, then that can mean that we're prone to have a very, very deep lumbar curve and not abdominals that just aren't quite strong enough to pull pelvis into neutral. So this is quite a good exercise to stretch out your lower back muscles and just to wake up those rectus abdominal muscles. We make this the last one. And then holding neutral, we'll mobilise shoulders. So we'll go over and circle, changing arms each time. You're looking for that straight arm, back of the hand, back of the wrist touching the floor as you take the arm overhead, sweeping it around to the sides. We'll make this the last one. And I think it'll be nice to have a go at the windows arms from here. So if you float your arms up, fingers pointing towards the ceiling, open the elbows to the side, rotate into the I surrender position, extend the arms up and pull it through. So this is the exercise that we did earlier on when we were standing against the wall. We'll do 2 more repetitions lying down on our back. So gravity helps us a little bit to get into the I surrender position when we're lying on our back. However, if you are managing issues with the muscles around your shoulders or the actual shoulder joint itself, This will be difficult to do, but it's important to do it as best you can to preserve your range of movement. We're coming all the way over, hands down by the sides again. Remember to press the palms flat, roll yourself up into bridge and roll yourself down. Nice dynamic movement, articulating that spine segment by segment to roll up and roll down. Ideally, when you bridge, you should be able to keep your feet flat on the floor in 3-point balance. Holding a cushion between your knees helps you to do that. We'll go 2 more cycles of bridge. And final one. Moving on to your opposite side, I'm going to swing my head and my heels around. For the rotations, let's balance it out. So side lying, long arm, neutral spine. Legs are glued together. We take a breath in, engage our core, reach to the ceiling, keeping the pelvis and the legs still. We exhale to rotate backwards. Hold the end point, breathe in. Breath out to return. Breathe in, engage the core, reach to the ceiling, breathe out, rotate. Sorry, it's 3 breaths we were working on, wasn't it? So let's hold it here. Breathe in, stay. Breathe out, stay. Breath in, stay. And breath out to return. Breath in, engage the core, reach the arm, gazing at the hand, rotate on the breath out and hold. Breathe in. Breathe out, breathe in, and breath out to return. Breath in, engage, reach the arm, gazing at the hand, breath out, rotate, hold it. Breath in, breath out, breath in, and breath out, return. Final time. Breathing in, engaging our core, reaching and rotating. Hold it there, breathe in. Breathe out, breathe in, and breath out to return. Side lying, thigh stretch with pelvic tilt. We bring the knee back to where we can feel the stretch, and then we tuck the tail between the legs and release it. Tuck the tail and release it. Tuck the tail and release. Tuck and release. 4 more times. 4, release. 3, release. 2, release. And last one, release it. Moving on to our back. If you do need a pad underneath your head, please use it. Okay, it's hip joint mobilization next. So keeping pelvis and the spine in neutral, working with the same leg all the time. For your heels, slide the leg down, rotate it out, slide it up and bring it back in. Slide it down, rotate it out, slide it up, bring it in. So this is our hip release exercise. Heel slide, rotate the leg out laterally, slide it back up, and bring it in. Heel slide, rotate, slide up, bring it back in. Now reverse the movement. Go out with your knee drop first. Slide the leg down, rotate to parallel and slide it up. Out with the knee drop, slide it down, rotate to parallel and slide it up. Out with the knee drop, slide it down, rotate parallel, slide it up. Last time with this leg. Out with the knee drop, slide it down, rotate to parallel, slide it up. Opposite leg, heel slide down, rotate out, heel slide up, draw it back in, slide it down, rotate out, slide it up, draw it back in, slide down, rotate, slide up and in, slide down, rotate, slide up and in, reverse it, knee drop, heel slide, rotate parallel, slide up, knee drop, heel slide, rotate parallel, slide up, knee drop, heel slide, rotate parallel, slide up, last time, knee drop, heel slide, rotate parallel, slide up, glue the legs together, stretch the arms out, knee roll, pelvis, knees and feet, rocking over to one side, but we're holding the adducted position, come back to centre. So I only want you to let your legs go over to the side as far as you can keep your knees and your feet together. So you're pressing, try to get maximum range of movement here in rotation. As you're pressing both of those legs over to each side. And last time. Releasing. Turning onto one side. We'll work the side lying leg series. If you're not comfortable on extended arm, please pop your head onto a pad and put your arm in a more comfortable position. So working with the top leg first. Let's just float it off the bottom leg, point the toe, raise the leg, flex the foot, lower, point, raise, flex, lower, point, raise, flex, lower, point, raise, flex, lower, point, raise, flex and lower. Point the toe, raise the leg, and then from the hip, circle 8, 7, 6, 5, 4, 3, 2, and reverse. Circle 8, 7, 6, 5, 4, 3, 2, and 1. Lower the leg down and notice where your top leg and bottom leg meet each other. Let's recreate that in the air. Float top leg just up, bottom leg to touch and lower. Top leg, 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 bottom leg to touch and lower. Top leg. Now you will be conscious of the muscles in your waist here working fairly hard. Top leg, bottom leg touch and lower. Top leg, bottom leg touch and lower. Both legs together. Raise and lower. Raise, lower, raise, lower, raise, lower. 4, 3. So the height of the raise is always quite low, it's quite discreet. Last one. Now lift your head and shoulders at the same time that you raise your head. Raise your legs and lower. And this concentrates it even more into the waist. So we've got both ends of the body, head and heels, moving towards each other laterally. Last 4. And 3. Last 2. And final one. Wonderful work. Rolling onto your tummy to work through breaststroke preps. Position your legs so that your heels point up towards the ceiling rather than them rolling out or rolling in, and then that will make sure that your legs are nice and parallel. Arms in a W position. Engage your core muscles. Exhale, slide the shoulder blades down the back. Inhale, peel the face and chest up. Exhale, release chest and face down. Inhale, release shoulders. Exhale, shoulder blades down. Inhale, peeling up. Exhale, releasing down. Inhale, let the shoulders go. Exhale, shoulder blades down. Inhale, peel the face and chest up. Exhale, release the chest and face down. Inhale, release the shoulder girdle. We'll make this our last one, and then we'll do a little bit of scapular retraction. We'll do that just by keeping our head and our shoulders, our head and our chest down, raising both of our arms and lowering them. Raising and lower. Raise and lower. Raise and lower. For 8, 7, 6, 5, 4, 3, last 2, and last 1. Lovely. Stretch it back with shell, crouching low over the thighs. Get down as close as you can towards your thighs, lengthening out through those back muscles. Arms are extended. If you are managing a shoulder issue, you may prefer to tuck your hands down by your heels. Last cycle of breath in and out. And release. We'll move to side lying opposite way. I'm going to switch my head and heels round. For side lying leg series, so we're in a nice straight line. I'm working with that top leg. We engage our core. Raise with a pointed toe, flex and lower. Point, raise, flex, lower. Point, raise, flex, lower. Point, raise, flex and lower. Point, raise, flex, lower. Point, raise, flex, lower. Point, raise, flex and lower. Last one. So it's side lying leg circles next. We point the toe, we lift the leg up, and from the hip circle 1, 2, 3, 4, 5, 6, 7 and 8. Reverse it. 1, 2, 3, 4, 5, 6, 7 and 8. Staggered leg lift. Notice where your legs touch. Raise the top leg, squeeze the bottom leg up, lower. Top leg, bottom leg, lower. Top leg, bottom leg, lower. Top leg, bottom leg and lower. Top leg, bottom leg, lower. Top leg, bottom leg and lower. Nearly there with this one. 2 more to go. Last one. Now it'll be both legs simultaneously. We'll do a set of 8. Raise and lower. 7, 6, 5, 4, 3, 2, and then 1. So it's head and heels at the same time. Raise and 2, 3 and 4, 5 and 6. Last 2, 7 and final 1. 8. releasing down. We move on to our back. We're going to do some core stability work with pelvis and spine in neutral, core muscles engaged, shoulders pressed back and arms pressed flat down to the mat. We'll raise into tabletop and lower out of tabletop. Change the lead leg, raise to tabletop and lower. So as you're raising and lowering in and out of tabletop legs, your torso should stay completely still on the floor. You're moving from your hip joint so that the angle of the knee stays constant. And this time we'll hold tabletop and we'll glide alternate legs out and in, out and in. Holding neutral all the time against the weight of the leg as it glides out. We've got 4 more, 3 more, 2 more, last one. Toe dips from tabletop, we'll dip down, tabletop, down, tabletop, down, tabletop, down, tabletop for 4 more and 3 more, last 2, last 1. Okay, one leg goes out straight and then that leg lowers. 8, lift, 7, lift, 6. Abdominals working really hard now. 4, 3, you know you've got to do this with the other leg. 2 and 1, glide that leg back in, change opposite leg, lower. 8, 7, 6, 5, 4, 3, 2 and 1. Change opposite leg, comes into tabletop, it goes out. Now instead of going down and up, this leg goes out to the side and back to the centre. Side, centre, side, centre, side and centre for 4, 3, 2, last one. Come to centre, change over legs, extend, go side, centre, 2, centre, 3, centre, last 4, and then you can take a break in your full body stretch position. 3, 2, and last 1. Wonderful work. Okay, let's lengthen it out. Enjoy that much needed break. And we'll stretch. Bring one knee towards the chest. Tip the pelvis back, flatten lumbar spine towards the mat. Aim to keep the other leg long and straight with the back of the knee open to the mat. This is our hip flexor stretch, and traditionally we should feel it into the hip and running down the front of the leg on this leg. You may also feel a bit of hip compression on the thigh that's tucked in as close as you can. Now keep this thigh as close as you can. Take your hands onto the ankle and extend that leg until you feel stretch here into this area of your leg. Hold it there. You're looking for the point where it feels uncomfortable but it's not painful. Breathing softly into the stretch, encouraging the muscles to relax. We'll hold for 4, 3, 2 and 1, releasing. Reverse the stretches, bring the opposite thigh nice and tight towards the chest, posterior pelvic tilt and flat back. long leg stays long, opening the back of the knee joint towards the floor. Keeping this thigh close to the chest, let's move our hands down to the ankle and extend that leg. Find the point where you can feel the stretch. It's going to be in this area, the back of the thigh. We'll hold it. For 4, 3, 2 and 1. Releasing. Set up for figure of 4 stretch, placing one ankle onto the opposite knee. Raise the leg. Take one hand through the legs, one hand around the side to support your leg. And getting a nice effective stretch in the external hip rotators. So just keep pushing that knee out to the side to maintain that lateral rotation. Breathing softly as you hold your stretch. Last 4, 3, 2 and 1. Releasing. Okay, opposite leg. Let's set it up. Figure of 4. Externally rotate. Keep the knee turned out. Raise the opposite leg. Again, work that turn out. So you're pressing the knee out to the side, feeling the stretch into the hip. Notice also the position of your head, your neck and your shoulders. If you've gone into a wee bit of a chin poke position and extended into the cervical vertebrae, just correct it by using a soft chin rock to bring your head into the better alignment. Holding the stretch, keep turning that knee out. We're here for 4 more. 3, 2 and 1 before releasing. We'll do short abductor lines on our back. Allow your knees to open to the side, turn the soles of the feet together. The stretch should be high up to the groin. If you're not feeling very much of a stretch, if you go into posterior pelvic tilt, flatten the lumbar spine and then try to press the knees open again. You may feel that you get a little bit of a better stretch just because you've changed the angle at the hip joints by changing where the pelvis is. We'll hold that for 4, 3, 2 and 1. Bringing the knees together and lengthen the legs. We're going to make our way to seated. If you find that you can roll up from the mat, reaching to the ceiling and articulating the spine up to come to seated, then please do so. Once we're seated, hip rotator stretch. One leg is long, the opposite leg is bent at the knee. You're going to get your heel as close as you can to your bottom. If you have got an artificial hip, it's generally advised to keep your foot on this side. If you have your own hip, you can cross it over and turn it. The stretch is going to be in the buttock, and it is important that you sit up straight. If you let yourself slump, it changes the position of the pelvis and takes some of the stretch out. Whereas if you can keep the pelvis as upright as possible, that gives you the best stretch that you can get. Changing legs. Holding for 4, 3, 2 and 1. Releasing. We'll finish with hip flexor stretching, kneeling. And we'll just use that lunge again to bring it into stretch. If you want to challenge your balance this time, you may prefer to tuck your toes under, raise the knee off the mat so that you are relying on your leg strength and your balance to keep you there. Place the palms together, reach to the ceiling and gaze to the hands. Holding 4, 3, 2 and 1. Releasing, gently lower down. Let's change legs. Put the same options on the opposite leg. So you've got a nice forwards lunge position here for the stretch. You can either keep the back knee down or you can tuck the toes. Come up into your balance position. Palms together, reaching to the ceiling, gazing to the hands. as we hold the stretch. 4, 3, 2, and 1. Releasing the arms, gently releasing the knee. Take a nice deep breath in. Stretch it up. Stretch to one side and then the opposite side. Okay, theory into practice. Best foot forwards, lunge to standing. Excellent. Thank you for joining me for the January 2021 essential routine. Keep practicing that until you get your February instalment. Good work.